you've been a lot better for a few days.
Okay, so with a knee, obviously you need to look at the nerve supply and the blood supply and everything to knees, so how the knees get their nutrition, how they get their power from. So you need to look and understand the spinal centres, so L3 downwards, so you need to have a look at that. Then the localised nerve supplies from the femoral branches, tibial and common peroneal branches, and posterior part of the obturator nerve, so you need to consider that as well. Blood supplies we know is from the genicular arteries, which is branching off the popliteal artery behind, so genicular arteries, superior, inferior, medial and lateral, and middle ones. So in terms of what I tend to do with locally to the knees is come into that popliteal region, get my fingers just into there, use the weight of the leg onto my hands, so not digging in but just allowing the weight of the leg to just drop onto my fingers, just to open out the back of the knee, open out the muscles and the tissues sitting in the popliteal fossa, which is behind the knee. See, at the front of the knee it's all bone and gristle, so we're really trying to get in behind the knee to really stimulate and open up the blood supply. So spend some time doing that. So once you feel the muscles begin to give a bit, then you know you're beginning to make a difference in the actual tension patterns through there. So the other thing you need to consider, of course, is the knee as a joint. So there's numerous joints in the knee. You've got the patella moving up and down. So we've also got the hinge joints. We've also got the superior tib-fib joint. And then all these accessory movements, really, which is really what we're interested in. So yes, we want to passively mobilise the knee into flexion and extension, which we'll do. Try and get as much sweeping through the joints as possible. But we also want this joint play, this sort of medial and lateral glide, and just moving around with the angles of that. So the tibia should glide underneath the femur, so if you grip hold of the tibial plateau you can just begin to take that glide from front to back. So as I say, these little accessory movements that you can't always actively do yourself, that people struggle to do. Occasionally we'll use the board, which just often stops you using too much force. So the board is a surface that just gives, that makes a clonk more than anything else. But if we bring that up, if you get hold of here again, just let the knee drop down. Just get used to the movement, and then we can just put a little bit more in. It'll just create that shearing force between the two bones themselves. So just take that in. Okay, so you're always retesting, always testing, making sure that things are beginning to change. They might only change a little bit, but if you're getting some change, that's good. So if we then take the leg up, so if I just bring that up, alright, okay, so isn't it today? Okay, so a little bit of compression in from the bottom to the top, and then we can just introduce that rotary movement. Again, the actual tibia should rotate around, not an easy movement to do. not only will you get some motion through the joints, you also get little bits of stretching through the actual soft tissues as well. So with this knee, it blocks inflection about there, starts to hurt about there more. So you can combine that, which can again just be a little bit uncomfortable, so take it slowly. You will feel often underneath your hands possibly little bits of grinding. As long as everyone's okay with that, that's fine. Okay, so if we take the leg down, and then we'll come over this way. So we'll come over to there. Okay, so what I like to do is I like to take the leg off, so you start to use gravity if you can. Hold it though, don't let it go completely. Take hold of the actual ankle and then just traction it down, so you're actually going that way. Fix it between my thigh and the table, so you've got it stabilised. Get the heel of your hand over the joint line, traction again, and just drop, drop, drop. And just work it. So you're gapping. So you've got that little accessory movement, you're gapping the joint. And what you'll often feel is just that little clunk as it moves in and out. Little clunk. Just work until you feel good movement. Don't forget to keep that traction on all the way. And then you can just change the angle. Let's feel the other side. You'll find with knees a lot more pressure is on the inside due to the quadriceps angle or the angle of the actual pelvis or hips as the legs come down. So more pressure on the inside of knees. You find you get the fixation points. Okay, just let the leg drop, come over the actual plateau, again keep that in, and then we're coming straight down, just with a traction which we'll do again later. Little impulse. Okay, let's take your leg up. Alright. So again, what you're doing is you're not rubbing the tissues. It's not a massage as such, but you're getting in and you're letting your fingers just sink into the soft tissues behind the knee. So you're letting the weight of the leg sink onto your fingers as opposed to rubbing and often irritating. You have to be careful, of course, because you've got structures behind the knee, the nerves that run behind the knee, so you need to make sure that you're not putting too much pressure around there. And then you're just waiting until things begin to soften up. Doesn't take long. Okay, and this one is a little better today than the other one. So what you might feel and hear is you might get an audible, you might get a clonk or something like that. You're not always going to look for that in joints because it depends how much fixation there is. So if there is a lot of fixation, then you may need to put a specific adjustment through. But a lot of the times the actual passive range of movement, mobilisation, getting the right angles is often enough. But if there is a significant fixation in the knee and you do need to put an impulse or an adjustment through it, then yeah, you'll hear an audible. It can be quite significant, can be quite dramatic, particularly if the knee's really locked up. So if we bring that over, always bring this leg over so you're not putting too much pressure. on the groin. So if you let your leg just drop down gently again, just coming down. So pin it in goes my hand, just onto the joint line. There's the traction, and then we'll just start in very small circles, just trying to get this medial and lateral gap in through the knee. It's often quite useful this if you start, or if someone's got sometimes a little bit of meniscal impingement, you need to get the knee unlocked. Even if they do need to be referred on, sometimes you can get the knee to unlock and give them a bit of relief, get them walking again. So worn knees, cartilage wearing down, meniscus worn down, little bits of connective tissue getting stuck, debris, that sort of thing. Always open the knee out. Remember, the surfaces need to wash over each other in order to be healthy. So you can do a lot of good work on knees, even though you might not necessarily be curing the problem. Okay, I'm just going to drop that down. Okay. Good. All right. Is that okay?
Yes.
Yeah, that's all right. Okay. So again, what we're looking at with the knee is we're just going to flex it up a little bit as much as we can, like this, and then put a movement down this way. So we're coming behind the tibia and we're just coming this way like that. Again, these are little accessory movements. Often you can get locking in rotation here at the tibia, so you might need to unblock that lock, and this is quite a good way to do it, as long as they can lie on their tummy, of course. You might need to take the tension out of your hamstrings just by raising the footrest up slightly or using some pillows. So I'm going to take the leg up gently, like this. And what I tend to do is just get right down, just rest it on your shoulder like this. Okay, and then come in. Just with your pisiform, just come in, come over, lift it up a bit more just by tractioning slightly, and then just this pumping movement down. Okay, now what you can do is build up the tension there, and if you feel that resistance, you can just impulse through it, and it's a squeeze. It's like someone's come behind you and dug you in the ribs and you're pulling in like this. It's not a pull down with your arms, it's just a squeeze. But I tend to just pump that with little impulses. Okay, make sure that you're on the tibia. Okay, there, tibia. Okay, let's see if that will just go down. Okay, so we'll bring this one up gently. I'll come in, just let your leg just drop. Take the tension out of the hamstrings. Take some of the skin slack out, get right in there, make sure you're on the right place. And then support the other hand, get your elbows in. And then just pull down. Play with the angle if you need to. Just searching for that resistance really. And if it's there, just pull down through it. Okay. So bring that down. Are you okay? Yeah. Do you want to come and sit up there? Okay, so once you're sitting up, just let the leg rest on your thigh. So again, this shearing movement, searching through the actual resistance or resistant points. Okay, these are joint plane motions. So the way I tend to do it again is just to cup the whole leg. So I've got it. There's an element of traction there as well. And then once you've got that on, we're just playing with the angle. So follow the actual line of drive from the elbow and forearm. Okay, so this is A to P, lateral, And again, just if you feel that resistance, you might need to impulse through it. Okay, take the leg over gently this way. Come over the top, and then again just down, just gap that inside. Good. Okay, so I'll take the leg down, let it rest between my ankles, come in, pin it between my knees, come in over the top again, and it's straight down. Good. Okay, so we'll come in, we'll just hook my leg around like this, and we'll gap this side. And then we'll come in and hook it round this way, and we'll gap that way. Okay, and you can use that quite nicely as a lever then, just to open out the knee joints. Okay, let's see this one, just gently. So again, just traction, rotate, come across. Okay, leg down. Just open out that inside of the knee. And don't forget, if you need to, just start shearing motion through the superior tib-fib joint. Don't forget the bottom of that, and the ankle as well. Okay, and one other method I use is similar to what we did earlier. The leg is coming up gently, comes up, stabilise it between my hand and my knee, and then just come up, come down into the tibia, and then into extension. Okay, so always remember to retest and test that motion and movement, but that's just some of the things that I would do to work locally through the knee.